have Wendy Savage from Keep Our NHS Public, who will provide some of the sort of national context for what's happening to the health service at the moment.
Well, good evening. The last time I was in this health centre was when I was doing a family planning clinic in 1973. And it was just when money started to be a problem, and the FPA in those days used to provide clinics, and we had to see 25 people per clinic. We were paid £7, £7.05, I think, an hour. And when I discovered, when a friend of mine got drunk, that he had to pay £7.10 to the male doctor who took blood from him, I thought this shows how discrimination is alive and well, even in those days. So, can you hear me?
No. Yes.
No. Okay. Now, Keep Our NHS Public was started in September of 2005, and it was started by the NHS Consultants Association, which is a group of about 700 consultants who, in the main, don't do private practice. The NHS Support Federation, which was started in the early 90s by Professor Harry Keane, in response to the first attempt to change our health service irrevocably, which was Kenneth Clarke. And let's not forget, it was Kenneth Clarke who came up with the idea of private finance initiative, even though New Labour have greeted that with open arms. The third person was John Lister from Health Emergency, who's worked tirelessly for 25 years to try and improve the health service, and wrote an excellent book this summer, which was called The NHS at 60 for Patients or Profits. And maybe the library could get that, because it's got a good historical background about the NHS. The reason we started Keep Our NHS Public was because we were really worried about what was happening to the NHS. And our aim was to inform the public, which we've done our best to do. We've set up 32 groups around the country who've lobbied against cuts in the NHS and attempted to bring to people's attention what is actually happening. Now, what most people don't know is that in 2003, the government set up a commercial directorate in the Department of Health. This commercial directorate was headed by an American from United Health, a company, a huge multinational company now, which has been indicted for fraud on many occasions over its existence, and featured in Michael Moore's film about the health system in America called Sicko, which I expect some of you saw. So what we were doing, trying to get somebody like that to change our health service, I don't know, but it wasn't exactly rooftop publication of that. This commercial directorate started setting up what were called independent sector treatment centres. And it's interesting that the government called it independent. These were private treatment centres. So where does this independence come in? Interestingly now, they've started saying, well, of course, GPs are private. They are independent contractors, but they're not private in the way that United Health and Care UK and these other companies are private. And we have to remember that the first duty of a company like United Health or Care UK or Humana or the rest of it is to make a profit for their shareholders. Where is that profit going to come from? The ideology of New Labour is that they will be more efficient and therefore they can pay their shareholders. There's not a shred of evidence for this efficiency, but they seem to cling to it with an amazing persistence. Now, this first person, Ken Anderson, I think his name was, left the NHS and went to run a bank in Switzerland. And his place was taken by another American, also from United Health, who left last year, according to the Department of Health, to spend more time with his family. according to Google and other such information sources, it was because there was a question of a lawsuit about fraud in the United States. So, for some reason, which is hard to fathom from what is supposed to be a Labour government, they have embraced this private corporate sector with open arms. These so-called ISTCs were paid 10% more than the NHS for the same operation. This first wave, they were guaranteed the money whether or not they did the operations. And as Frank Dobson says, it was like getting the 9 operations at the price of 10. I've got it the wrong way around. And the other things that they have done, which I think make it quite clear that for some unfathomable reason they want to privatise the NHS, is that the NHS supplies were made into a separate organisation called NHS Logistics. And then 3 years ago they were put out to tender, and DHL got the contract for that. And Patricia Hewitt said, oh well, this will save us £1 billion over 10 years. The quality of the gloves supplied by DHL are not quite as good as the ones before, and that's how they make their money, their profit, to give to their shareholders. Also, DHL in the States, it's a Texas-based company, have very bad labour relations. They subcontract and don't allow people to be part of a union and don't pay their drivers a decent wage. It's another way that they save money. The whole private finance initiative is a scandal, and the Tories have leapt onto this, and despite the fact it was their idea in the first place, and pointed out how much money will be paid back to these companies. And the Norfolk and Norwich Hospital is one that you may have heard of, where they sold, the company built the hospital, then sold it to some equity company and made a huge profit, of which they gave a few million to Norfolk and Norwich. Okay. So this latest thing about polyclinics, which came from the Darcy review, I mean, the Strategic Health Authority, London, said that 51% of people agreed with polyclinics. This was 4,000 responses to their consultation out of, because you're Surrey as well, about 6 million people. You can see that this is hardly indicative, and any of you who had anything to do with that consultation will know that the questions were loaded in all sorts of ways. In February this year, the London SHA sent out a directive to PCTs telling them that they had got to get plans for polyclinics, and these should be up and running by early next year. What is the rush about this? The whole question in Darcy of who's going to pay for these polyclinics was not addressed. And although the idea of having things under one roof may well be good, the really important thing is, if we have these put up by private companies who are directing the people in them to do what they say and not allowing GPs to have their own rooms and all those sorts of things, it's certainly not going to provide a good service. Now, in Haringey, they have got a plan in Haringey to reduce, to put all the GPs practically out, 70 GPs, something like 50, to go into new polyclinics. Where are these buildings? What's going to be in them? What do people think about it? It's not at all true. And the consultation process has been absolutely lamentable. And I haven't got time to read you from the letter from the speech of the GP who spoke there. But it's happening all over the place. What is the haste? Why do we have to rush in to doing these things? And I do have sympathy for the PCTs because they are directed by the Department of Health to do these things. And they really feel they have no choice. Personally, I think they do have choice. I think if our PCT members stood up to government and took them at their word, they say, you're going to have local decisions. Darcy says these decisions are going to be clinically led and with consultation with people. It's not happening. And I think
What we've got to do is to make the PCPs understand that we want proper consultation, not these rush jobs, and decent data. I mean, I read the thing in the Islington Tribune, and it sounds very